Tell me what you know about left-sided heart failure.
I don't know anything.
Are you sure about that?
Okay, look, I saw a guy. He was older for sure. He didn't have much mobility. I mean, I saw him run, but it wasn't very fast. I mean, he was coughing a lot. It was super dyspneic. Uh, it looked like the guy just got hit by a train. I tried to call him to figure out what had happened, but he seemed super confused. He wasn't really responding.
Is that all?
Yeah.
Don't make me stick in.
Okay. All right. Look. So I called up to him. He was lying on the ground, coughing even more than he was before. I mean, it must have been orthopnea or something. His body was cold. It was obviously from a lack of perfusion. And when he coughed, it sounded super congested, like his lungs were filled with fluid or something. But look, that's everything I know, okay? I swear. If you want any more info, you should try somebody else.
Officer, so you were saying?
We know the pump failed. Who sabotaged it? Give me the causes.
Look, man, I didn't touch a thing, I promise you. The system was already wrecked from the inside out and the guy had chronic hypertension, okay? It was serious, I'm telling you. Pushing against that kind of pressure for years, it will blow up any motor. Even my own will blow up, I'm telling you. It would boom. Yeah. But or maybe the supply lines were completely clogged with plaque from coronary artery disease, I guess. Yeah, but I'm telling you, the heart muscle was damaged from myocardial infarction. It wasn't me. I'm telling you, it really wasn't me. Maybe it was someone else, but it wasn't me.
Save it. Tell me exactly how the system broke down step by step.
Okay, look. The main pump, which is the left ventricle, right? It just got way too weak to push up any fluid forward, you know. Or maybe it got too stiff to fill up. I don't know. I'm telling you, I don't know. But because it couldn't push blood out of the body, the pressure went crazy, like it went kaboom. The blood had nowhere to go. So it backed up into the left atrium, I guess. Yeah, it was the left atrium, yeah. And then it shoved right back into the pulmonary veins. That is why the guy's lungs were drowning in fluid, the lungs were drowning in fluid. See how that sounds? Yeah. And forward flow drops, and everything behind gets swams, and that is the pathophysiology. I'm telling you, that's all I know. That's everything I know. I'm telling you. Can I go home now? Cause I had a long night and I need that sleep. Can I go home?
All right. Start from the top. What exactly are we dealing with here? Define the operation.
Look, the operation is simple, but it's a complex clinical syndrome, all right? The main boss, the left ventricle, just can't pump enough blood to meet the body's metabolic demands. It's a basic supply and demand issue. The pump fails, the forward flows drops, and everything backs up behind it. That is the little definition of left-sided heart failure. It's not just a disease, it's a whole failing system. You cops just don't get it.
We need hard evidence to put this away. How do we prove the system is failing?
Okay. I'll tell you exactly how to get the proof, but like, we've got to cut some kind of deal. You've got to look at the imaging. Get an echocardiogram. That is your smoking gun. It'll show you the ejection fraction. It'll prove that the left ventricle is slacking on the job. And you got to pull the lab work. You need to look for an elevated BNP, which is brain natriuretic peptide. That like proves the heart muscle is stretching too much under the pressure. And you got to get a chest x-ray. You'll see that the pulmonary edema, all the fluid is backed up, it's in the lungs, it's plain as day, you'll be able to see it. that is your paper trail. Then you're clear. Now can we cut that deal?
Official diagnosis, left-sided heart failure.